Good morning, ladies and gentlemen. Thank you for having me here and inviting me here. There's a little misunderstanding, I think. I'm not preparing for any complex case. Besides an interventional cardiologist, I'm an MPH. I'm a Master and Doctor of Science in Public Health. So my presentation will be on pharmacoinvasive strategy. So I leave it to the panelists and the moderators here if I'm happy not
It's
to
fine.
present the...
It's fine, it's fine.
Really? So I think my apology for ruining the party. Just see of this as a refreshing variation. I'm going to skip lots of cases, so I'm basically going to talk about STEMI reperfusion strategies for patients who cannot receive timely primary PCI. And on the last part of my presentation, I will present that our idea in our professional organization is adopted by the Ministry of Health, who is now conducting a pilot project on this approach. So this is basically my case. So a inferior infarct STEMI, so who could not make to the referral hospital in time, so we perform fibrinolytic, and then we do a PCI once the patient arrives in the hospital. So as you can see here, there's a flow in the RCA, and then which improved the patient condition significantly. So we know that in patients with STEMI and symptom onset of less than 12 hours, who we anticipate that the primary PCI could take more than 120 minutes, it is advisable for us, or even it's a must, it's a 1A class recommendation to perform fibrinolytic. So there are lots of data that I'm going to skip this. So we chose a fibrin-specific agent, in this case, the easiest one to administer with a single bolus, which is tenecteplase. And we are familiar with this guideline, as I mentioned before. Even the most current one advocate for giving fibrinolytic. In this case, this is also mentioned in our national guidelines. This is basically the evidence showing the benefit of, or the superiority of pharmacoinvasive strategy for patients in STEMI who could not make to the referral hospital for timely PCI. So I'm going to just skip this. So we just tenecteplase. So this is the part where I brag about our program that is being adopted by the Ministry of Health. You know that if you are familiar with how bureaucracy works, especially in Indonesia, it is not easy to convince the Ministry of Health. So there is now a pilot project of what we call FAST-STEMI program, which give fibrinolytic in patients with STEMI in community health center before referring the patient to PCI-capable hospital. This is the background rationales for that. And this is quite something because there are now 283 files of, in this pilot project, fibrinolytic agent, tenecteplase in this case, being distributed to 45 community health center, which then the doctor, general practitioner in the community health centers, performed tele-ECG consultation with cardiologists, our organization members, who will give a go, let's say, a confirmation of whether the patient is eligible to receive the agent or not, and then they will administer the agent and then perform the patient to the cardiologist in hospital with cath lab. So as a key summary, for STEMI patients, we know that getting to PCI center within 120 minutes is critical, and in most of the case, at least in our country, is not just not possible, and most of them is not achievable. So this is where we consider pharmacoinvasive strategy. And fibrinolysis as part of pharmacoinvasive strategy provides more benefit and outcomes compared with late primary PCI. And choice of fibrin-specific fibrinolytic therapies are preferred, as we know that it gives less bleeding side effect and immunogenicity, better profile of immunogenicity, which gives superior patency rates and less immunogenicity. And with that, I conclude my presentation. Thank you.